We're proposing to evaluate a new treatment for post-traumatic stress disorder, or PTSD. In this study, we will enroll and treat 12 veterans who've been diagnosed with PTSD. Each volunteer will come in for 3 daily treatments and a 1-week follow-up visit. Low-field magnetic stimulation, or LFMS, is a treatment for depression and anxiety that we have invented and developed here at McLean Hospital. Low-field magnetic stimulation is a changing magnetic field that's produced by a coil that we've designed and made. The low fields that are in LFMS are strong enough to give a little bit of an effect near the synapses. Now, when you take a pharmaceutical, when you take an antidepressant like Prozac, that helps the neurotransmitters near the synapses. And in some way, we're working on the electromagnetic fields right near those synapses. Nerves work on chemicals and electricity, and we're approaching it from an electrical point of view. Now, in subjects with depression and anxiety, it has an immediate effect on mood. People sit right up and feel better if they're a responder. We're hoping that this is going to carry over into PTSD and make the treatment of the core symptoms that much easier. The first step in an evaluation like this is this pilot study, where we'll look for effects in 12 veterans, and if we can establish that effect, this will be carried on to a full study at the VA hospital. PTSD is a very complicated disorder, and it affects an awful lot of veterans in this country. If we look at overall statistics, almost 7% of everyone in the United States will be affected by PTSD sometime in their life, with 3.5% affected at any one point. If we look at statistics for veterans, those numbers go up. Veterans' lifetime prevalence of PTSD is almost 31%, with 15% affected at any one time. Now, our hypothesis is that the depression and anxiety will be affected, but our hope is that LFMS will actually be able to calm our patients down so that PTSD can be addressed a little bit more easily. We're not going to get rid of cognitive therapy, we're not going to get rid of medications, but it might reduce the need for them. It might provide immediate relief in a crisis situation, and it might just be a good overall tool in approaching PTSD. The study will cost $50,000 over 6 months. Most of these funds will cover salary for the psychologist, for the investigator, and for the research assistants who handle and treat the subjects. There will also be money needed to pay for the subject costs and for the analysis of the data. If you decide to donate, you'll be helping us move forward with this pilot study. Well, thank you for supporting our research. Thank you for supporting this effort to help with treatments for PTSD.